at director@moscowchamber.com. Again, that email is director@moscowchamber.com if you'd like to email it rather than putting it in the chat. Jim Miller with the University of Idaho, who also serves as the Moscow Chamber Foundation Leadership Moscow Chair, has graciously allowed us to use his Zoom platform today. So I wanted to thank him in front of all of you for his support and appreciation that the Moscow Chamber of Commerce has for the work that he does as a volunteer. And he will be filtering the questions. And so if you do have any questions, don't hesitate to send a chat or something to me or Jim Miller. So we have the privilege of having a couple of individuals who are really boots on the ground when it comes to our current environment. On behalf of the Moscow Chamber of Commerce, we'd like to thank you for taking the time to be here today. Our two main panelists today are Carol and Kara. So for those of you on the call, please know that we are going to hear from Carol first, and then we will be hearing from Kara from Gritman Medical Center. If you have anything that you would like to ask them directly, again, we do ask that you put that through the chat through us so we can filter those questions to them. Here we go. So I have the privilege of introducing Carol first. So Carol Moehrle has, for the past 25 years, has served as the District Director for Public Health, Idaho North Central District. This public health district covers Clearwater, Idaho, Latah, Lewis, and Nez Perce counties in north central Idaho. Carol reports to the Policymaking Board of Health, comprised of our local county commissioners, and she is active locally as well as nationally in public health. She's very passionate about public health and shares her passion with numerous public, private, and nonprofit organizations. With that, please welcome Carol.
Thank you, Jenny, and good morning or noon, everyone. Thank you for the invitation to be here today and to share a little about public health and what's going on in, of course, our world of COVID, because it seems like that's about all there is right now in our public health world. We started with COVID in February, had our first case mid-March, and has been growing and changing ever since. Public health's main role in the COVID pandemic is in doing investigations of those people that are testing positive for results, investigating, making phone calls with them to determine how they are, where they might have contracted this, and who they might have had a close circle of contacts with that they could have spread it to during that infectious time. So as you can imagine, we topped 2,000 or more cases yesterday. And all of those people, some of them having between 2 and 20 contacts that they've labeled or identified for us to contact to see if there's been a direct exposure. So a lot of our work is phone calls, trying to reach people, trying to help them understand the process for isolating and quarantining themselves during an outbreak like this, but they have been exposed, watching for signs and symptoms, how they navigate that world of staying home for 14 days or more, depending on their exposure to a positive case. So we have what we call our investigators and our contact tracers on. We've actually put on many part-time temps to help us with this. The University of Idaho has been a great partner. They are doing a lot of the circling of those university students with the infrastructure and needs that they have for food and shelter and keeping isolated. So they're helping us with the contact tracing on the university campus as well. And then many of our providers, our healthcare providers especially, are helping and doing their own contact tracing in their own populations also. So we have a lot of people working on COVID and trying to help protect our public as much as we can. We felt pretty good about things. I'm going to share a little bit of data with you and continue to talk as we go through this. If you haven't been out to our website, the public health, it's Idaho Public Health, idahopublichealth.com is our official website. And this is what you'll see when you click on our COVID site. This is the data that we in District 2, Public Health District 2, are collecting on a daily basis for the public to be transparent. We're using a Microsoft 365 BI platform, so it's very interactive, and we're pretty excited about that. The state of Idaho also on the coronavirus.idaho.gov site has comparable data statewide in a different format and some different data than we collect. But as you can see from here, we're broken down by the 5 counties that are in our health district. And down at the bottom here is Latah County. So when we click on that, you can see that it then readjusts the colors in the pie chart here and will tell us that of the cases, of the 831 cases since we started in March in Latah County, that we have 800, oh, excuse me, that the clues over here on the side for the age groups, that's our 18 to 25-year-old population. So of all of those, we have had 854 in that population. Oh, gotta love the little highlights. When we look at moving on through data, which I'll do just quickly so not to be boring, the next page, of course, shows you a breakout. And if you highlight on Latah County, it again will show you the differences in our race, our ethnicity counts, our open cases and closed cases. We're just about equal in those that we've closed, the people that are through their cycles, through their exposure and their quarantine and have moved on and we're able to close out of our system. If you notice down here, the majority of those 800 cases, 607 of them are in that population age 18 to 29. It truly is a representation of the great work that the University of Idaho is doing and continues to do in screening their students and staff. So when the university chose to screen everyone at the start of school, our numbers, of course, went up. When you screen, you'll find, and they did find. So there was a big uptick in those numbers in Latah County as it related to the university. As we move through here, this will tell you where we're finding these when they're reported to us. You see the gaps where they're not reported on weekends. Those are those methodical gaps that you see in here. And then down here, this is the report dates, but here's when the people are telling us their symptoms are really being onset. So their symptoms are onset usually a few days before they go to be tested, and then there's a few more days before we receive the reports. So we're lagging just a little in the time that their symptoms have started and they maybe are contagious or infectious, and when they actually are reported to public health. Again, trend lines. For those of you that are that really like to play on your computer and again interactive, you can choose what county you want to see the trend line that you're looking for. So this is Latah County's trend line since we started. You can adjust the date frame here. So if you want to look just since the first part of September through October, great job, Latah County. Our trend line's actually going down in the number of cases being reported on a daily basis. In Latah versus the trend line overall health district, you can see at the bottom that is trending upward. And then the last slide I just show, this looks like maybe this is an empty page, but truly what it is a chance for you all in your time to go out and sort this data like you might want. So we have 2008 cases. If we choose to sort by the county, here we go. These are the cases by county. Latah County, 831 cases. If you click on that, then you can sort by age range if you choose. And you can sort in this population age range. You can see in the whole of Latah County, 607 again of those in that population of 18 to 29-year-olds. You can sort those by race if you choose. You can sort them by what sex they are, male and female, just about comparable. So a chance for you all to drill down a little bit more if you're choosing to with the data that's out there from the public health site. So not to bore you with more data, but that's how we are looking right now. Again, when you click on Latah County, you'll see deceased is blank. There have been no deaths reported at this point in Latah County. And let me just mention that just a minute. When we hear of deaths, we hear of them anecdotally or factually, but public health has to receive an official death certificate with COVID listed as an identified cause of death. And that has to, of course, come from through the coroner or the attending physician. Death certificates are all registered at the state of Idaho in Boise at the Department of Health and Welfare. They're then validated there, and then that report comes to public health. So we are oftentimes week or more, 2 weeks even or more behind on reporting deaths, just depending on the death certificate circle that it has to make across the state. So just wanted to clarify that. There have been some comments or concerns in Latah County about having no deaths reported on the data there. So with
Carol,
yes.
if I could, this is Jim Miller, if I could interrupt you real quick just for a question. The question in the chat box was, do those numbers include the Nez Perce Reservation, or is it exclusive of that?
So when we look at the Nez Perce County numbers, they definitely do include the Nez Perce tribe and those numbers in Latah County. Yes, okay. They are included in Nez Perce County, excuse me, Nez Perce County's numbers.
Perfect. And then another question, if someone passes away and COVID is listed on the death certificate, do they have to pass away in Latah County, or if they go somewhere else for treatment, is it counted as a Latah County
death? If they have their residence listed as Latah County on the death certificate, their permanent residence, then it is always comes back to their home county of residence. If they are by chance have a residence in another state, even though they had been a hometown Idaho person, it would be counted in the county of residence.
Okay. Thank you very much.
So I'll stop sharing right now to see if there might be questions or concerns that I could answer at this point. Again, the data, Latah County was behind on Nez Perce County for quite a while. They just took the lead a little about 2 weeks ago or so. Latah County jumped up a little bit higher than Nez Perce County in their numbers. And again, when we drill down on those numbers, like you saw, that population age group with the highest percentage of numbers in Latah County, it's that 18 to 29-year-old age group. So many of them reported out as being university students. So we have to put a big shout out and a thank you to Gritman and all of the work that they are doing with testing, multiple opportunities for testing, with lab capacity, with all of the help that they're giving in Latah County, primarily, especially with the students and the general population in that we have there. They are our main go-to as far as the medical experts in our communities. So with that, Jenny, maybe I will kick this over to Kara, and I see Connie sitting there with her. And
I'm gonna put you on the spot, Carol, for one more question that just came up in the chat box. Can you separate by town in the county? So can you look specifically at Moscow numbers at all, or do you have those available that you can distribute?
That is a really great question. We are working as we speak on whether or how to release by zip code. Knowing that at this point, they're telling us we're really cautious of confidentiality and protected health information as it relates to COVID. Some of our really small towns or small communities that have their own zip code even may not have a population base big enough that people could say, oh, there was that, we know Johnny Jones, we know him down the street, and there's one positive case in our community. We're trying really hard not to be able to pinpoint specific people in the data, but we're getting closer to at least being able to separate out the city of Lewiston and the city of Moscow, and from the rest of the county there. So hoping in the next few weeks, we'll be able to do that for everyone.
Is there data on behaviors that result in most infections in a county? Do you have any behavior information at all?
We have anecdotal information from all of the interviews that we're doing. And that's a really good question. We haven't thought to collect that somehow because it is just anecdotal, but I would need to do some more checking in on that and to see. Of all of the behaviors that we know, I mean, our standard messaging that the Chamber of Commerce has helped so much in the Moscow area, physical distancing, wear a mask, cover your cough, stay home if you're sick, wash your hands, use your hand sanitizer. All of those common preventive messages continue to be the behaviors we're watching for. We are noting that people that are saying that maybe they tested positive because of an exposure, if they are wearing a mask and the people around them are masking, there is much less transmission to that other circle of friends. So that's anecdotal again, but we are hearing from a lot of people that everyone's masked, and then the follow-up that we're doing with those investigations, no one else is getting it from there. So we hope that continues.
I think that's all the questions we have so far in the chat. So thank you.
Yes, thank you.
Thank you, Jim, and thank you, Carol. Carol, as you mentioned, yeah, let's pivot to Kara, and then we can always come back to either one of you. But I have the pleasure of introducing Kara Besst. For those of you that don't formally work with her or have heard from her before, Kara Besst is the president and CEO of Gritman Medical Center, where she has worked for 26 years. Originally from Idaho Falls, Kara graduated from the U of I with a Bachelor of Science in Accounting. Prior to graduating, Kara started at Gritman Medical Center as an intern and was hired as an accountant in Gritman's Fiscal Services Department after earning her degree. She became Gritman's Chief Financial Officer in November of 2000 and assumed the role of President and CEO in February of 2011. And she lives here in Moscow with her family. Welcome, Kara.
Thank you. I do have Connie Osborne is our Chief Quality Officer here at Gritman, and Connie has been here for about 44 years, and is also serving on Public Health Board. And so she's been instrumental in working with our incident command team on COVID here at the hospital. As Carol mentioned, we had our first case back in February. We actually kind of stood up our incident command back then and have been actively meeting for the hospital side, and then also working with public health area hospitals, the Idaho Hospital Association regarding COVID, and obviously some of the challenges that we've seen in the healthcare system about PPE testing. And so I'll kind of talk a little bit about the testing. So as Carol mentioned, we worked quite closely with the University of Idaho. So now what we have is our former ICU is essentially a lab testing for COVID, and it's a partnership between the University of Idaho and Gritman on setting that up. It took probably about 3 months to get that set up. It's here. They can now run COVID tests. We have tested, we're kind of in our second round of testing students, and we have processed a little over 16,000 tests through that lab. And as Carol mentioned, as you test more, then you're going to start seeing that. So we started releasing our positivity rate and have been working with our medical staff on how to manage patients, how to manage how they enter the hospital. And so if you haven't been to the hospital, obviously you really can't get into the hospital unless you have an appointment here, and we're trying to keep COVID out. We just started releasing about 3 or 4 weeks ago that we have had hospitalization. So we've only had 5. And similar to what Carol said, as far as releasing, if we have people in the hospital right now with COVID, we're not releasing that because of the HIPAA and trying to respect the privacy of our patients. So that piece is still at that total of 5. As far as some of our kind of next steps that we're working on is, if you haven't looked out your window just recently, we were just having a hailstorm, and obviously we have several types of testing tents. So we're using the Martin Wellness Center for our rapid testing, mobile testing in there. And then also in our emergency room parking lot, we have a mobile respiratory tent. Since we know winter's coming, we are actually actively looking at switching how that could be in that flow of patients. Obviously, not being able to be outside is a concern, and how do we do that safely for the patients and also keeping our staff out of the elements in there. So we are working on that. That is our main push right now. The other piece that we've been working on is flu shots. We're in the process of doing flu shots for all of our employees, and that's not new. We actually mandate that our employees get flu shots, so we're in the process of doing that. And then we've also distributed flu shots to all of our clinics, so that way they can do that. And we're trying to encourage the community to get their flu shots out there. So those are a couple of pieces, and I'll stop there and see if Connie wants to add anything else to that discussion.
So being part of incident command and liaison officer in our structure is I'm on the multiple calls weekly with Latah County to city to regional to public health, and even there's been calls I know Kara's been involved with for the Panhandle District, which is north of us, of public health, and us, so that we know what's going on in each other's areas and who may be seeing an influx of patients or issues. And bed availability is one of the things that we track, but it's also a state and federal requirement for bed tracking. Also keeping track of all of our personal protective equipment. So we keep that as a daily rate, so we know how much we have on hand and what we need to do to allocate those. We work closely with public health, but also the region, and knowing what areas that could be a focus, like for example, what Carol just said, when Nez Perce County is going to see an uptick in that. What do we need to do up here on the Palouse to be either good stewards and figure out how we can work in concert if they should need to transfer patients. And so that's kind of one of those things that we have done all this time, but during a pandemic, it just brings it to more of a forefront. So we've been busy, as Kara said, with lots of testings and coming up with all the logistics of doing that. And we have an amazing staff that seems to rise to whatever occasion we have. So from doctors to our clinics, doctors in the hospital, nurses, even our labs, there's everybody's involved. So it's been a real new world as we've gone through this pandemic so far. But so far, I think what we've been able to establish is that the things that we put into place have really assisted us with taking care of our community. So as Kara said, there's only been a total of 5 hospitalizations, and that's with the University of Idaho and our city making sure that there's masks being worn, that people are social distancing, they're sanitizing their hands and their surfaces, and it obviously has made a difference. And one of the worst things as a hospital, and talking to some of these hospitals that have been overran with patients, is allowing that trickle in, if you want to say that way, so that you can handle those cases. And if they do require further dialysis or something along that line that we may not offer here, that we're able to transfer that patient safely to the appropriate center. So I'll stop with that as well and see if Kara has any more, or if you want to ask some questions.
Kara, did you have anything you wanted to add? Okay.
Not
Right
right now.
Okay. could, and this may be a question for all three of you, so feel free to chime in, but how can folks in general that are a part of the vulnerable population, but also youth, how can all of these individuals stay active and healthy when the weather is beginning to turn? Do you have any recommendations?
Nope, I think Carol's speaking up there.
Go ahead. No, you guys go right ahead. I'll follow.
Well, one of the things that we've had at Gritman for a while is we have our cardiac rehab program. We've had our wellness center that is now our drive-through testing that we're getting ready to plan to reopen to allow people to come in of vulnerable populations in a safe manner, of social distancing and whatnot, to use the wellness center as well as cardiac and pulmonary rehab to continue to exercise and maintain their health. We've had cardiac rehab open or reopen now for a while. We scheduled patients so that we make sure we don't have more than what the social and safe distancing can do. Obviously, it's kind of hard to exercise wearing a mask. So we actually have face shields that our patients wear that are cleanable and reusable. And some of those actually came through help from the University of Idaho and some laser cutters. So it was a group effort on those. So we do have those available for patients. For those that are sheltering at home, which is pretty much most of the population, is getting outside in a safe manner, just even doing some walking in your neighborhood. Again, mask if you're immunocompromised, and that can't be stressed enough.
I'll just add, we have seen, the data has shown this pandemic has been really difficult on most people. Staying home, the isolation is detrimental to people's mental health and their behavioral health, their physical health, all of that. So what a great question. We're trying as desperately as we can, and Gritman leading the way in Latah County, of course, in helping people find ways to make sure they still get outside. We want them to protect themselves from others, but not to just stay in their homes if they don't have to. Wear a mask if they can, but walk your neighborhood. Go to the mall if you need to. Wear your mask. Stay that 6 or 10 feet apart if you can. Do that walking, but trying to, the isolation has been very, very hard on the population as a whole, everywhere. So anything you can do to get your neighbors out to help you do that as well. Even if you have to shout across the fence or across the driveway or the street, get outdoors and take in that fresh air. I know the winter's coming and then the snow brings on different challenges, but we do encourage everyone to try to get some physical activity, keep their brains going and keep them not totally cooped up and isolated. It's a real dilemma that this pandemic has brought to our citizens.
We do have a couple more questions showing up in the chat, so I'll ask a couple of those, if that's okay with both or all of you. How has COVID impacted Gritman's use of telemedicine? Are there procedural changes that arose out of this, or will those continue after we return to quote unquote normal?
I'll start that. So actually telemedicine was an avenue that we wanted to go down, and there was some challenges, but once the pandemic hit, we were able to do that from working with Medicare and Medicaid and the payers. So it's actually been very helpful for our patients and the physicians to be able to start at least screening some patients and having patients. What we've seen is that patients, especially on the early onset, that people were avoiding the hospital, and you know what we've kind of heard is kind of 3 scenarios. They had concerns about getting COVID at the hospital, and we've tried to make sure that people know that this is a safe area, and we have put in procedures to help make sure they are safe in our clinics. There was also a concern about patients overwhelming us because I'm assuming they were watching some of those hospitals in New York and seeing how overwhelmed those hospitals were. But our volumes back in April, we saw about a 60% decrease in our clinic visits. So then that concerned us, where we were starting later in June and July, where we were seeing patients coming into the emergency department because they had a delay in care. So we tried to get that message out that, you know, what are our processes? So you could do a telemedicine visit. If that physician felt that they needed to see you in clinic, that we would have those protocols set up, and we tried to communicate that out to the community, to our physicians. And so it was a very close working relationship. As far as moving forward, we see that right now there's not a change as far as us continuing to use telemedicine. Kind of the comments out there is the cat's out of the box per se. And so we hope that that's a usable feature for us. It's been very helpful for the community in there. The challenge that we do run into is some of the outlying areas based on the internet speeds in there. So.
And I'd add to that is we've even had some of our services be able to go to telehealth. So for example, some of our diabetes education services are able to be done through telehealth. Some therapy visits are able to be done through telehealth now too.
Great, thank you. Another question. News reports over the last few months have forewarned of an increase of cases as we go into winter. Can you comment on that? Do you see that trajectory increasing at all?
Well, I'll start and then we'll move on. So we're concerned. You bring normal routine influenza, seasonal influenza into the mix with COVID, the virus, and wondering what it will be in our areas. A great reason everyone should get their flu shot. Everyone out there should get that flu shot so that hopefully the prevention of that normal influenza, that seasonal influenza, can be taken care of by the coverage of that vaccine. And then we can deal with maybe the COVID virus as we go. We also know that as fall and winter approach, more people are indoors. And if we're indoors and not masking or watching for that physical distancing, there's going to be more opportunities for exposure in a closed air system. So we're anticipating that. We know our schools are back. They're doing a great job in monitoring kids, but we're putting more people back in spaces together. So I think it's expected that we will see maybe an uptick. I think we're already seeing some of that just with fall already here and schools back in and more people back in there trying to get back into normal routines.
I think the other thing too is it's kind of hard because people are, as we mostly heard referred to as COVID fatigue. And so people tend to let down their guard when they're, you know, obviously we're so far into this in so many months. But again, it's kind of remembering the basics of just sanitizing surfaces. And as Carol said, the more you're going to be indoors, the more important that is. So if you think of your high-touch surfaces in any business to any school, those are the things that need to be kind of ramped back up.
Another question for Carol. Has the health district been tracking other diagnoses such as depression, suicide, or any mental health issues? Do you track anything like that at all? Have you seen an increase or decrease in any of those other things?
We are tracking that with, of course, with partners. We're not doing that data gathering on our own, but we are monitoring, and I can certainly share that with the chamber if you'd like some of that data. We are early on, suicide rates were definitely climbing quite rapidly. Fortunately, they have it leveled off some, but our calls to the state suicide hotline and to those suicide services has definitely increased and continues to increase. So on one hand, we're pleased people know that they recognize a place for a resource. The other area where we're noticing more activity and more demand is through the crisis center in Latah County. More people calling, feeling like they're in crisis. and maybe not directly related to COVID, but indirectly, again, because of the isolation, because of their housing, other issues that might be going on. But we do watch the suicide rates. Depression is a little more anecdotal, but we're hearing that through the crisis centers, and we are tracking that. So I'd be happy to share that data with you all, Jenny. You can share it with your members.
Thank you, Carol.
Can you tell us some about the collaboration with the University of Idaho? I know we have several people with WWAMI on the call right now, but does Gritman staff the isolation that's on campus, or is that just a university facility? What's that collaboration look like?
Yeah, so the university we are not helping as far as staff the isolation. Early on, back in March, the end of March, we actually worked with the university and kind of walked through how to manage those students if they had students in there. So we help provide that support, but the university is actually doing that. They will reach out to one of us, either Connie or our chief medical officer, who is Dr. Brown, regarding, if they have questions. Really our main partnership where we are staffing is when we do these testing. So at the rec center, it is our staff that is taking the swabs, the nasal swabs in there and helping collect those samples from the students.
Thank you.
Sure.
I think we have time for a few more questions, Jenny, if that's correct. Okay.
Yeah, I'll ask one while folks may be thinking of something. Kara, how can the community support Gritman?
Well, I would say, again, I think our community has done a wonderful job. And I want to thank the city as far as putting in the mask mandates. That has helped us as far as trying to be ready. And, I mentioned that the earlier challenges is, we were able to get more ventilators. We were able to secure more PPE. Testing obviously has continued to be an issue. And even though we do have this lab set up, we are actually trying to secure more testing equipment in there. So I would go back to what we've kind of talked about, getting your flu shot in there, not letting your guard down. I know it's really easy if you start becoming around family and thinking that it's okay not to mask, that's where we're starting to see some of the exposures in there, because people are again, kind of tired of wearing masks. And so that's what we would ask for. And then if you are starting to have symptoms, making sure that you are isolating and doing those pieces. We've had, as far as testing and getting those results back, if you are having symptoms and are getting tested, to isolate and not go out and expose anybody else in the community.
Another question that came in, are there other types of testing available besides the nasal swabs?
Yes, there are. However, the nasal pharyngeal swabs are still the most sensitive and precise diagnosis of COVID. So there's the rapid tests. Some of those are just nasal swabbing, not the nasal pharyngeal. Those tend to be not as specific and sensitive to getting false positives or false negatives, but they're still a screening tool. So let's say if you have symptoms and it does say you're positive, you would still then go and have a nasal pharyngeal swab done to verify that. If it gave you a false negative maybe, and you have symptoms, you've lost the sense of taste and you still have a sore throat and shortness of breath, you then probably need to have further testing to say, are you definitively not COVID positive if you have symptoms of COVID? So the rapid tests are good that you get a result faster. They're just not as specific. and sensitive. So that's always kind of the caveat. If you have a group that, let's say, a housing group that did the quick testing and there was a majority of positives, well, then you'd want to do some testing and quarantining that facility for the period of time that we've all been following through the CDC. So does that help answer the question, you think?
That's great. Yes, thank you.
Connie nailed it right on with the specificity and the accuracy of the varying tests. But you will be hearing, I think, in the real near future that the state of Idaho is working on a contract with some of our pharmacies, the big box pharmacies, they call them, Albertsons and Walgreens and maybe Walmart, some of those that have pharmacies, to do testing in their pharmacies. Now, anyway, they also are working on, I'm just saying, if I were sick, I wouldn't want to go into a grocery store pharmacy and think that I was spreading this in the grocery store. But they're working on ways to have a quick test, like Connie said, so the specificity is lower, but they could maybe send it to your home and you could do your own swab or a spit test is what they're working on also. Lots of moving parts when it comes to the world of testing. Everyone's getting into the testing kind of, realm. Many of them not having the time to go through the true FDA licensure and validation. So they're getting what they call an emergency use authorization that says it's probably good enough. So again, we're relying on that PCR gold standard as much as possible for the accuracy. But just so you know, there are these other options coming out. And many of our long-term care and assisted living facilities have been sent testing equipment to their facilities from the federal government so that they can test their residents on a routine basis in those care facilities. So testing is a moving target, really. But like Connie said, again, there's different levels of accuracy, specificity, and PCR is still the gold standard, but others are out there.
Tell us about the vaccine or vaccines. Is that realistic to expect? Or is that way, way far off from an insider medical industry point of view?
Well, I'll start, and maybe Kara and Connie know more. The governor has put together a vaccine task force in order to look at how, when the vaccine is available, Idaho will get a shipment of doses based upon population is what we understand. And then of course it will be distributed based upon population to the different parts of Idaho. In our 5 counties in North Idaho, we have about 6% of the state population. So as you can imagine, when Idaho gets a shipment of whatever doses that might be, we in our 5 counties to distribute will get about 6%. But the governor's task force is looking at how to then reprioritize vaccine we might get. Similar to H1N1, when those priorities came out from CDC, their guidance from CDC on which groups should go first with the vaccine opportunity, but leaving some of that up to individual states. What I'm hearing most is that, of course, we need to protect our healthcare workers first in order for them to continue to take care of these people that have coronavirus. So healthcare workers, our EMS that are responding to people, transporting in ambulance, those type. Our elderly, of course, because they are being hit with the most detrimental outcomes for the coronavirus. And at that point, that's pretty much where the discussion has stopped in Idaho so far. The governor's task force meets again on Friday to have more discussion on testing criteria. Our tribes are in that first round also, but they will get vaccine shipped straight to them, not having it part of our distribution, we understand. And making sure that it's equitable, it's ethical, it's looking at all of the high-risk populations. In southern Idaho, the Hispanic population has been hit very, very hard by this coronavirus outbreak. And so prioritizing some of those individualities across our state or where the outbreaks have been hardest hit with the most detrimental outcomes. So more to come on that. I think we're all expecting there will be vaccine. It won't be here by the election. It won't, I would assume, not be here by January 1st, but they are hoping that by spring or summer, there should be a vaccine available. Kara or Connie, have you heard more?
Yeah, that's a kind of what we've been reading when the information comes out on the status of the vaccines in testing right now or assessing. And so what we're seeing is it's not going to be until spring, possibly summer. And then it's going to be limited. It doesn't, from what I've seen, and I'm sure there'll be more studies coming out, that it's not going to be initially geared towards children. So it'll be more of an adult vaccination when it does come out.
And I'm just sharing a few anecdotals since we have a little time maybe. So the different strains of vaccine that they're making, the different companies, at least one of the companies, the vaccine needs to be stored at a negative 70 degrees. Now, most pharmacies, health departments, clinical offices, doctors' offices don't have freezer or refrigeration that goes to minus 70 degrees. Our hospitals with their lab capacity do, but that's about all. So a vaccine that's that fragile out of that temperature is kind of being looked upon by others going, how would we even manage that? I mean, we'd have to figure out a way if that's our only option, but there are a lot of different variables in the vaccine that's being produced in the different companies right now, and the idiosyncrasies of each of them as far as how many, once it's brought to room temperature, it can only be used for 6 hours. And how do we make sure that we don't waste one dose of this vaccine if it all has to be distributed in a 6-hour time period? So every partner, every medical partner out there will be included in how to get this effectively into the right population when the time comes.
Great information. Thank you. A couple more questions have come in. Kara and Connie, what's the capacity of Gritman to handle ICU level COVID care, or will you treat locally, or will you refer those or send them elsewhere if it's an ICU case?
So we have the capability of we have a 6-bed ICU, and with the COVID funds that Kara talked about, we were able to get a 4th ventilator. We do adult ventilator, so any pediatric patient that would require ventilation would need to be transferred. Mostly our transfer centers obviously are to Kootenai Medical Center, Coeur d'Alene, and the Spokane facilities. But so far as we have anesthesia machines that can be used as ventilators, so we can up all of that to the full 6-bed capacity. We have planned for even more. So if we do need to convert some of our observation beds or inpatient beds to CCU beds, we can do that. It's thinking about the staffing required for that, the respiratory therapists, nurses, doctors, hospitalists. Our hospitalists have been part of the planning for extension of ICU beds if we need them. So that's pretty much the plans are in place. So far, we really haven't had to use that plan. So I think we're doing well there. Again, it's severity of illness, and depending on the strain of COVID that is appearing, depends on how ill and sick and immunocompromised and chronic conditions a person has.
I would add on a couple of things. So we are what's called a critical access hospital, which means that we can only have 25 inpatients at a given time. With the COVID piece, we could actually file a waiver and we could go above that. And if anyone's familiar with the hospital, we have our 2004 wing, which is the south side of the hospital. So that was actually built and we opened it in 2004. But when we were in the building process, we were not critical access. So we actually built it for 43 beds. And then we do have areas of the hospital where they were our old med surge and they were our old family birth center. And so as we've tried to plan over the last 6 months, as far as what is our capacity and what it could look like, I would say the biggest piece that kind of limits us is staffing. And, you know, what we've seen in other hospitals is having our staff exposed. And so those are the concerns that we're kind of running into, in the sense of when we talk about capability and capacity and stuff. And just hearing from the other hospitals throughout the state is that's one of their challenges is staffing. The other challenge that happens is trying to place those patients back into nursing homes. And nursing homes have limited when they could actually bring a patient in, and usually it's been 14 days after they have stopped showing symptoms of COVID. And so that's been some of the other challenges that we've tried to deal with. But right now our census, we've been able to manage that. We haven't had to shut down elective surgeries, but all of those are part of that consideration as we continue to maneuver through this pandemic from a hospital side.
Excellent. Carol, can you tell us about your collaboration with Whitman County or Stoughton County? You know, what are you doing across the border to communicate and coordinate?
You know, people that don't live in border communities don't understand this at all, but we all do. And people don't know the road between Moscow and Pullman, or the Blue Bridge between Lewiston and Clarkston, as a barrier at all. We have daily conversations with both of those other entities, those health departments in the state of Washington, primarily because we're just trying to figure out where people live. And some of the confusion I know in our population, if they live on the Idaho side, public health from my district investigates and calls them on the phone. If they have an address, they live in the Washington side, even though they live in Idaho and maybe are exposed in Idaho, Washington calls and does their investigation on that side. So there is some ongoing confusion with our populations. I think we've navigated those waters quite well after we, you know, went through the rapids and the falls and all of that in early March and April, but we do have daily conversations to make sure we're all on the same page. We, of course, as you have seen too, report our data a little differently. We all report to different boards of health and different governmental entities, but all in all, we're trying to do our best. If there's ever suggestions, we're open for those. Communication is absolutely the most important part through all of this.
Excellent. Excellent. Thanks. I have one more question in the chat, and then I'll kind of turn things back over to Jenny. I ended up, I think, asking more questions than anybody else here through this format we had. Just want to make sure that she doesn't have any questions via email. But the last question in the chat, and you touched on it just a little bit, Kara, but can you explain a little more the preparation for increased testing as we see the cold and flu season ramping up? You mentioned moving some testing to a little warmer facility and stuff, but can you re-elaborate that or re-explain that, please?
Sure. So I'll kind of start with the University of Idaho. So right now that all of that testing is done at their rec center. So it's all indoor now. Originally we set it up so it would be outdoor, but because of the ventilation that they have, we just put it indoor. What we're talking about right now, and we have not finalized, is essentially trying to combine. Obviously, our tent outside in the ED parking lot is not probably going to survive snow and keeping our staff warm. And so we are looking at essentially a small modular building out there. We're talking about potentially putting it out on, it would be the west side of the hospital. And try to combine it so it's all right here, because what we're looking at is kind of the flow of the patients, and so essentially combining what's being done at the Martin Wellness Center and in our ED parking lot and just moving it right in that area is what we're talking about right now. So there's been a team, Connie's been a part of that, where we've looked at those pieces. We're also looking at the quick care facility as far as if patients, so kind of the process is if you have symptoms, COVID symptoms, you would do a telemedicine visit. if that physician needs to essentially have you in a clinic, then we're talking about potentially using that quick care center as that respiratory area, and then setting up all the protocols in place to keep everybody safe and our staff safe. If they need testing, then they would just come hopefully right outside the hospital and have a mobile, still a kind of a drive-through clinic. We've talked a little bit about trying to get strep and influenza testing there too, the rapid testing. So that way, if an individual needs a COVID test, influenza, or strep, it would just be kind of that one-stop place to do that, to help conserve on PPE for our staff and limit to the exposures. So that's kind of our winter plans that we're doing.
Excellent. Excellent. Thank you.
You're welcome.
Jenny, I'm going to that's all the questions I have in the chat. I'll turn it back over to you.
Thank you, Jim. I actually did not receive any questions via email. Thank you for those that participated via chat. For those of you that want to share this information with others, we did record this and we can upload this to our YouTube channel. We also include all of our recorded meetings in our newsletter. And if you're interested in getting our newsletter, please reach out to us. You can reach out to myself, call us at 882-1800 or email us at info@moscowchamber.com. And of course, if you're interested in being connected with any of the folks on the panel today, we can provide you contact information as well. I want to give a big thank you to Carol, Connie, and Kara for taking time out of your extremely busy schedules to provide us this platform today. We truly appreciate it. And again, a thank you to Jim Miller and the University of Idaho for hosting the Zoom. I would like to just provide all three of you an opportunity to give any closing comments. We have just a couple minutes. I'll start with Carol if you have any closing comments.
I think, the standard prevention, public health messages, like we've all said, if you're sick, stay home. If you have signs and symptoms, don't infect each other, isolate yourself, wash your hands, wear your mask, even though it's like we're mask weary also, but you've got to, it's a real protection in our public. We know it works. So get outside if you can, stay healthy.
Thank you, Carol. And Kara or Connie?
I would say again, the emphasizing of, yes, we know it's challenging to come into the hospital, but don't delay your healthcare. We've unfortunately seen that. And so we want to make sure that everybody knows it is safe coming in. And we do have the protocols in place to keep everybody safe and our staff safe. So I want to thank everyone for participating in what they're doing as far as helping protect our community.
Our website is always a good place to check out the latest information and updated information regarding what's happening at the hospital to what's happening with COVID and what if we are having restrictions and all that kind of stuff. It'll be right on that website. So our team does a good job of keeping that up to date.
Yeah, that's absolutely true. Thank you so much for providing those suggestions and your closing comments. So it is 1 p.m. exactly. So thank you so much again for everyone's time for being on the call. Thank you to our presenters. We truly appreciate it. Have a wonderful day, everybody.
Thank you.